From the rise in HIV cases and the thousands of lawsuits against health providers to heartbreaking testimonies from citizens still waiting for medical attention, we'll take a closer look at how the health system in Huila is responding to this crisis. We'll also discuss the concerning increase in suicide rates and the spread of dengue in our region. Each story, each voice tells us a little more about what's really happening behind the headlines. Good evening, welcome to Neiva News Days, your trusted source for the most relevant stories shaping our city and its people. My name is Heidi, and tonight we bring you an exclusive report focused on the health challenges that are making 2025 stories that affect families, patients, and the entire community. Let's begin with our top story. The alarming rise in HIV cases reported in Neiva this year. Health authorities have confirmed 89 new cases of HIV so far in 2025, a sharp increase that has raised major concern in the region. Specialists warn that low testing rates, stigma, and misinformation are fueling the problem. Here is our first report. Do you know someone who has been diagnosed with HIV?
Sí, de hecho es una compañera de tercer semestre y pues su nombre es María José Castro. Para ella fue muy difícil guardárselo y pues me dio la confianza de decirme lo que le había sucedido y lo que le diagnosticaron.
What kind of support or help has she received from the health system here in Neiva?
Pues no es muy bueno el servicio porque pues ella al pedir citas y de la programación que ella les dan, siempre le programan una cita y se la cancelan o si no se la corren, pero pues solo ha tenido como 2 citas nomás y pues la verdad ella ha averiguado en otros lados como tratamientos particulares y pues está demasiado costosas para ella. Entonces pues la verdad es como muy importante que ella reciba un tratamiento especial porque eso depende en su vida.
How the situation affected her family and daily life?
Sí, ella cuando me comentó sobre la situación, ella se mostraba como preocupada y pues triste porque pues me comentó que pues no sabía cómo decirle a la familia. Entonces pues yo me ofrecí, yo le dije que pues cuando ella quisiera darle la noticia a la familia podíamos ir. Entonces fuimos a la casa, reunió a la familia y pues le comentó la situación. Pues al momento, como cualquier noticia, pues ellos no sabían cómo reaccionar. Y pues ella se sintió muy triste, entró en su lado como de depresión y pues de frustración porque no sabía cómo le iba a recibir el mundo.
As we have seen, the growing number of HIV cases in Neiva reminds us that prevention, education, and empathy are still key in protecting our community. Doctors insist that early detection and constant awareness campaign could make a real difference, but they also highlight the need of stronger institutional support. Because behind every number there is a person, a story, and family waiting for answers. And speaking of institutional response, up next, another growing concern: more than 2,500 citizens in Neiva has filed lawsuits against health providers for delays and failures in medical attention. What's behind this wave of complaints? Who's responsible, and what are the patients demanding? We'll break it down for you.
In Neiva, the healthcare system has researched a critical point to the extent that many users are forced to file legal actions like tutelas just to have the EPS authorized medical procedures or provide the medications they need. What should be a fast and human process turned into a chain of delays, excuse and silence that puts people's health and dignity at risk. The tutela, which should be an exceptional resource, has become practically the only tool patients have to receive care, revealing serious failures in management, timeless, and the responsibility of the entity that is supposed to protect their well-being. Now, we are going to interview someone who has had to go through this situation and who knows these problems firsthand. Okay, Carol, did you feel that the tutela was the only way for the EPS to fulfill its obligation?
Absolutely. The tutela was the only way the EPS actually did their job. You go, you ask, you call, you send emails and nothing. But the moment the huge order arrived, everything suddenly moved quickly. That proved they could have done it earlier. They just didn't. It's sad and infuriating to realize that your health depends on a legal process when it should be something immediate and human. I didn't want to resort to that, but the practical forced people to take legal action just to get the medical attention they need.
Have you ever had to file a tutela to get a medical procedure authorized? What you mean to do it?
Yes, I had to file a tutela because I have no other choice. I have been waiting for months and then to authorize a medical procedure that was essential for my diagnosis and treatment, and the EPS symbol wouldn't respond. Every time I went to ask, they told me to keep calling, that the system isn't showing anything or that I needed to wait a little longer. But that little longer turned into weekends and then months. I feel ignorant as I were beginning for something that isn't a favor but a right. And in the end, when my health started getting worse because of the delay, I realized that if I didn't file a tutela, no one was going to do anything. It was a hard decision, not something that I wanted to do, but something they practically pushed me into.
This panorama highlights the urgent need to strengthen health services in NEIVA and ensure that the right to medical care is fulfilled. Health cannot continue to depend on guardianship, it must be an effective guarantee for everyone. There is a person waiting for a surgery, a treatment, or even a simple medical appointment that never comes on time. Authorities say that they are working to improve response time and guaranteeing patients' rights. But for many citizens, these promises still feel too far from reality.
The theory of medications in NEIVA has also become a serious source of dissatisfaction among EPS users. Complaints about unjustified delays, long lines, and the lack of communications about treatment availability are increasingly common. Many patients, including those with chronic illnesses or delicate conditions, must wait weeks to receive essential medications which directly affects their health and quality of life. In some cases, people are forced to buy a medications themselves or suspend their treatment, demonstrating that the system is not responding with the timeless or responsibility it should guarantee. Next, we will hear the testimony of a person who has suffered these delays and who is sharing their experience today.
Have you had to wait a long time to receive your medications prescribed by the EPS?
Yes, and it's become a regular occurrence. Every time I get a prescription, it's the start of a real odyssey. I've had to wait anywhere from a week to over a month to receive something that should be immediate. You stand in endless lines, go from one window to another, and in the end the answer is always the same. It's not the system, the order hasn't arrived. Wait a few more days. It's that something as basic as medication has become such an ordinal.
Do they inform you of the reasons for the delay, or do you feel there is a lack of communication on the part of the EPS or the pharmacy?
Communication is terrible. No one really knows what is going on. I asked at the pharmacy and they told me it is the EPS responsibility. I go to the EPS and they told me it is the provider's problem in some cases. They have given me absurd excuses such as the system is down or the authorization has not been processed yet. It is a chain of errors in which no one takes responsibility, and the worst part is that there is no empathy. They treat you as if you were bothering them by asking for what is rightful.
Cases like this show the fragility of mental health system in the region and the importance of addressing the needs of those who depend on its treatment in time. Empathy and efficiency must go hand in hand to prevent more people from suffering from the lack of medicine or aid. This case shows how delays in mental health treatment can have serious consequences. Every patient deserves timely care and respect. Authorities are alarmed by the increase in suicide cases in Huila this year.
Hello, Zaidi. In the department of Huila, there has been a worrying increase in suicide cases. According to the Huila Department Health Secretariat, so far in 2025, 54 deaths by suicide have been reported, compared to 91 in 2024. Although suicide attempts have decreased, 462 in 2025 versus 788 in 2024. The situation remains alarming, especially among men. Because of this, authorities are urgently calling for stronger prevention efforts, better mental health care, and the involvement of different community sectors. Today, I will interview a citizen. Her name is Maria Heidi, and she is going to answer all our questions. Okay, today I'm with the citizen Maria Heidi, who will answer all of our questions. Mrs. Maria Heidi, first of all, I want to ask you, what do you think would be most effective to prevent these cases in your town, and what should be the role of the institutions, government, and citizens?
Bueno, las medidas preventivas para este tipo de situación de los suicidios que se vienen presentando especialmente en el departamento del Huila, es necesario tomar medidas efectivas como, por ejemplo, inicialmente en los hogares, enseñando a los niños a ser resilientes ante cualquier situación difícil que se les presente. De igual manera en las instituciones educativas también, que los profesores puedan ofrecer este tipo de apoyo a los niños, a los jóvenes. Y en cuanto a las entidades gubernamentales, que ellos creen leyes que le permitan a los profesores, a las instituciones educativas, ofrecer este tipo de apoyo para evitar que esta situación tan difícil se presente.
Thank you for answer. Okay, Mrs. Maria Heidi, the next question is, what do you think could help people feel better and avoid these sad situations in Huila?
Bueno, pues una de las situaciones que favorecerían para evitar esta situación en el departamento del Huila sería inculcando a los jóvenes, a los niños desde el hogar el amor propio, que se sientan seguros de sí mismos y pues evitando que sean excluidos de los grupos, de las diferentes instituciones a los que ellos pertenecen, y también ofreciéndoles oportunidades donde puedan hacer actividades lúdicas, culturales, deportivas, que les permitan pues centrarse más en su propia vida y evitar que estén hablando, pues tengan ideas como estas de suicidio.
Thank you for your answer.
The increase in society reflects the urgency of talking openly about mental health, providing accompaniment and breaking stigmas. Taking care of the mind is also taking care of life. And as a society, we must act with sensitivity and responsibility. Meanwhile, health authorities have issued an alert for a surge in dengue cases across Huila, with over 170 infections reported so far this year.
Welcome to our news program. Today we address an issue that has raised concern among authorities and the community in the department of Huila, the increase in dengue cases. According to reports from the Departmental Health Secretariat, more than 170 cases have been confirmed so far in 2025, representing a significant rise compared to previous years. This situation has set off alarms, especially due to weather conditions that favor the spread of the transmitting mosquito. Authorities are urging citizens to strengthen prevention measures and eliminate breeding sites around their homes. Okay, today I'm with the citizen Thomas, who is going to answer us our questions. First of all, what symptoms should people watch for if they think they have dengue?
Bueno, los síntomas del dengue son, primero, dolor al mover los ojos, en las articulaciones, decaimiento, falta de aliento y sueño constante.
Thank you. And what recommendations would you give if someone have dengue?
Indispensable para prevenir tener repelente constantemente, evitar estancamientos de agua en las casas, principalmente porque este es un mosco que se desarrolla en la parte urbana y no en los campos.
Thank you for your answer.
The increase in dengue cases in Huila not only reflects a challenge for health authorities, but also a shared responsibility with the community. The transmitting mosquito reproduces in stagnant water, and its control depends largely on prevention in our homes. Every uncovered container, every forgotten puddle or discovered tank can become a source of contagion. For this reason, environmental education and joint work between institutions and citizens are essential to stop the spread of this disease that has already affected more than 117 people so far this year. Public health begins with our own daily actions. We come to the end of this broadcast of NEIVA News Days. Thank you for joining us. See you in a future edition. Bye bye.